Ladies and gentlemen, dental enthusiast and curious mind. We have a distinct privilege today to be in conversation with truly luminary in the field of dentistry. Please join me in welcoming the international acclaimed clinician, researcher and educator, Professor Dr. Chandrashekar Yavagal, sir. Sir, thank you for being with us today. First of all, congratulations, sir, for getting GEA for Best Innovation in Laser Dentistry, which happened few months back, sir.
Thank you so much, Dr. Indra. In fact, it's my proud privilege and honor to be on this podcast and talking to all the young minds of this great fraternity in our country. Thank you for having me here. It's my pleasure to be talking to you today.
Welcome, sir. Hope we have a very enlightenment session today. So going on, sir, your journey to become a distinguished figure in dentistry is truly remarkable actually. Could you please take us back to your early life and share what inspired you to pursue a career in dentistry?
Actually, I come from a very small town. I'm sure you would not have even heard of it. It's a town called Hubli Dharwad, in the northern part of Karnataka. So my father was a medical practitioner. He used to practice in a nearby village. And all the time I would see my father struggling with his practice and struggling with his patients. And he did everything possible to help and serve the society. But in return, the kind of rewards he was getting for the efforts that he was putting somewhere, I felt that it was a thankless job that he was doing. Mm-hmm. And on the other hand, I had a comparison. I had an uncle who is an endodontist, and I kept on comparing the two. And I felt that the endodontist uncle of mine was able to reap much, rewards for lesser efforts that he was putting in. And that's where I felt that, dentistry is an amazing way of healing people. At the same time, it's a profession which rewards us for the hard work that we put in. Unlike a medical practitioner who will have to slog day in and day out, and at the end of the day, they don't seem to be rewarded for the efforts that they are putting in. So that was the first time that I felt that I should take up dentistry.
That finally you didn't opt dentistry as in second option, which generally nowadays people used to do. Like if they don't get MBBS seat, they think like, okay, we can go on for dentistry. Actually.
Yep. In fact, I have a small story to tell you. I still remember the year 1997, and I had a very good rank, and I was there on the first day of the CET counseling in the state of Karnataka back then. It was called as the Common Entrance Test. And I still remember reading the headline in the newspaper the very next day that after the first round of counseling at the Common Entrance Test, 549 and one dental seats have been opted. And that one dental seat was my seat. So people, in fact, over there thought that I had lost my mind, that I was leaving an MBBS seat and opting for a BDS seat when I had the choice of getting into any government medical college, which I didn't do.
Actually, sir, if you do repeat this, people will think that you are not in your state of mind. That's why maybe you are choosing. And
maybe if they see me where I am today and what I have done with dentistry, maybe they'll realize what was the logic behind that choice. And let me tell you again, Indra, not for one day have I regretted that decision. Never.
Yes, and maybe after listening your stories also many minds change. Hope so. Coming next, your academic achievements are truly inspiring, with top honors in your BDS and gold medal in MDS in pediatric dentistry. Could you share with us some of the defining moments that led your specialization in pediatric dentistry and orthodontics, and how these fields have shaped your career?
Well, I have always understood one thing, that life throws us many choices, and we tend to take a long time to decide which choice is the best choice. I have always understood one thing, we need to choose the option that gives us the maximum happiness. So choose something that makes you happy, and invariably that will be the best choice. And I have been doing this, and it's no exception when it comes to choosing my specialization. I chose pediatric dentistry simply because treating children gives me immense happiness. I don't like children. I love them. I adore them. And that's the reason why I did not think twice when I had to opt for a master's degree. It was a simple decision for me because I just asked myself, out of all the branches that I have to pick up a seat, which is the one which is going to give us maximum happiness? And the answer was pedodontics. And that's why I chose to be a pediatric dentist. And somewhere along this journey, I also felt that unless I equip myself with the knowledge about fixed orthodontics, my job as a pediatric dentist or my role as a pediatric dentist would be incomplete. I will not be doing justice to my child patients because pediatric dentistry is an age-defined specialty. So below 14 years of age, I should be able to perform all the treatments. And somewhere I felt that I was handicapped by my lack of knowledge about fixed orthodontics in children. And that's the reason why I chose to pursue my diploma in orthodontics from the Orthodontic World Institute, Barcelona. And somewhere I felt complete as a pediatric dentist after that qualification. So here again, not a single day that I have regretted being a pediatric dentist. I love my job.
So I won't be wrong, sir, if I say that dentistry also gives you many options to pursue your interest, basically. Like by hearing your story, I can clearly conclude that you had a passion for kids and you did it. So dentistry gives you ample of space to pursue your own interest, actually.
Absolutely. You're absolutely right. This is my 18th year as a pediatric dentist. So 18 years is not a small time. And let me share one very important thing, what I have understood in these 18 years as a practicing dentist and as a practicing pediatric dentist, that, dentistry is an amazing field. Unfortunately, the kind of projection it gets in the society and the way our own colleagues talk about it is extremely sad. The only reason what I can think where dentistry gives you so many options, so many ways of making a difference to so many lives that you touch. So the only reason, if you ask me, what kills dental careers is not the lack of degrees, jobs, or patients. I'll repeat that again. The only reason which kills dental careers is not the lack of degrees, not the lack of jobs, not the lack of patients. It's the lack of exclusivity. So if you have that exclusivity, if you have found your niche, then trust me, there is no profession better than dentistry for me. And with the kind of technological advances that we have today, I feel it's the best time to be a dentist. It's the best time to be a pediatric dentist. In fact, just yesterday, I operated on a 3-day-old baby with a tongue tie, and the baby was not able to latch on to the mother's nipple. And for 3 days, the baby was being fed artificially. It was not able to suckle the milk. And I used a technology which allowed me to release that tongue tie without touching the lingual frenum. Would you believe me if I say so?
No, sir, actually.
Without touching the lingual frenum. So this is what I am trying to tell, that the kind of technological advances that are there at our fingertips today, this is the best time to be a dentist.
Actually, sir, I also feel the same. Given that pediatric dentistry is relatively new field, if I'm not wrong, what are some of the areas within it which are uncharted yet?
Well, pediatric dentistry is a young branch for sure. And we are always young at heart. We remain so. As long as you keep spending time with children, I believe that you will never grow old. So whatever be the mindset that you enter your practice with, whatever the stress that you enter with, the moment you see a child patient and start treating one, all that stress just melts away. And this only a pediatric practice can help you achieve. But yes, like you said, there are many, many untouched areas. There are many areas where we still have to do progress. I just gave you one example, what I did yesterday. And this is a very new, very fresh branch of managing tethered oral tissues in newborn babies. You know, babies who are unable to latch, who are unable to feed well, who are unable to lactate well. So there is so much work to be done in this field. And luckily, I've been working with lasers for 18 years now. And this case that I told you yesterday, a 3-day-old baby, I used a blue wavelength with which I'm able to revise a frenum, with which I'm able to release a tethered oral tissue without even touching it. I mean, this was unheard of. You've heard of the cliched ways of handling it with scalpels and scissors and stuff like that. And then there were people who were doing that with diode lasers, and then there were people who were doing that with erbium lasers, and I'm doing that with a blue wavelength, which allows me to to revise this kind of a frenal attachment in a newborn baby without even worrying about the bleeding or the postoperative sutures to be placed. Nothing. I don't even touch the tissue. I just take the beam of laser close to the tissue and boom, it melts like butter. So this is something that is going to change the way we look at infant oral surgery. It's going to change the way we look at neonatal surgery with lasers especially.
Actually, to be very frank, sir, these things are sounding very fascinating to me. Reading that old days book that where the pediatric dentistry was all about management, behavior management. This actually sounds very fascinating, sir. So
it is. I mean, pediatric dentistry is all about behavior management. But yes, then since you asked me what are the sort of untouched areas, these are some of them which we are working on currently.
Mm-hmm. Your expertise in laser dentistry and biophotonics is widely recognized. Could you elaborate how your fascination with the laser began and how these technologies revolutionized modern dentistry?
Again, like I keep telling you, I never choose the option that I find it to be the best. I choose the option which gives me the happiness, and then it invariably turns out to be the best option. So years ago, it was 2006, and I was a fresh MDS pass out. I was a jobless pediatric dentist sitting in my clinic, and I remember a baby walked in. It was a 42 days old baby, and it had a mass in its mouth in the lower on the lower ridge. Mm-hmm. And I still remember this incident because my receptionist came inside with the case paper, and she told me that, sir, when I asked the parents what name should I write for the child, they started weeping. I said, what happened? They said, sir, the child is 40 days old, and the last month and a half, they have only spent running from one clinic to the other. They had gone to an oral surgeon. They said, this child has to be taken under general anesthesia for excising that mass. Somebody else told them, scared them that sutures have to be placed, and a week later, the child has to be sedated again to take those sutures off. Somebody told them that this could be malignant. Somebody told them that this could be hemangioma, and the child could bleed to death on the table. They're so scared that they have just come to you thinking that laser technology will give them an answer. And they have told me, this is what my receptionist told, that in the last 40 days, they have not even had the time to have a formal naming ceremony for the child. Uska naam hi nahi hai, because they never got the time to have a formal naming ceremony. Every other day, they were in a new clinic trying to find a solution for what the child was born with. That is when I felt that I should do something to help this kid. I still remember that the face of that baby. I still remember the innocence in those eyes. And it was back then that the first laser module that was happening in India. Mm-hmm. And there were some big names which were involved with it. And I got myself trained the very weekend when I happened to see this case. And then I came back with a bigger problem. I came back with some information about what to do with the laser, but then I did not have a device, right? I mean, back then my condition was so poor that I could not afford an erotor. How on earth would I afford a laser? So it was such a situation that I had to take a laser unit on rent for 350 rupees from an ophthalmologist in my small town. Mm-hmm. So I remember paying 350 rupees and taking that bare fiber. I had no freaking clue what that wavelength was. I had no idea that a bare fiber should not be used. Nothing. I mean, today I spend days together, hours together teaching my students what is tip initiation and why it is an unpredictable science. Back then, I did not even know that a bare fiber should not be held, without a handpiece to be used as a surgical tool. But I had to do that. And then the results that I got after this was so very encouraging that I really felt that this science has to become commonplace. More and more Indian dentists should be able to use a laser. More and more Indian dentists should be able to afford laser dentistry. Only then it will reach the masses. If the dental surgeons of this country do not have an access to a laser device, how on earth would our countrymen, how on earth would our patients get the benefit out of it? You will be able to serve your patients only if you are trained in the technology, and if you have the, if you have the resources to afford the technology. So that technology had to become affordable. And that's when I started working on a little bit of an entrepreneurial edge to this science. And like I said, it has again got to do with the passion, with the interest that I had to serve those patients that I was treating, nothing else.
Actually, this is a very inspirational and an emotional story which you told actually. So your list of achievement is truly inspiring, including being the only Indian dentist invited by WALT as a speaker and a chairperson. Could you share some of the most memorable experience on the international stage and how they have shaped your perspectives?
Yeah, like I said, since 2006, I have been working with different laser units from different manufacturers, from different countries in the world. And I always felt that this science has to be more affordable. Only then our dentists are going to use this. So I have never left an opportunity to venture out and talk to international experts on what they feel about how to make this technology more affordable, so that we could produce one in our country and then make laser dentistry affordable. That's exactly what we are doing right now with our entrepreneurial venture called Novelist Technologies. So this was possible because of the interactions that I had with international clinicians, with international industry experts, manufacturers. I have had the experience of working with the best of units internationally, with the worst of units internationally. So I exactly know what works and what doesn't work. So the difference between an instrument designed by an engineer versus an instrument or an equipment designed by a dentist, obviously it's a no-brainer. You know which one will be more user-friendly, because something that is designed by a dental surgeon will obviously take care of all the pain points that I experienced in 17 years of me being a laser specialist. Coming back to the World Association for Photobiomodulation Therapy conference that you are talking of, that was in Nice, France. The year was 2018. This was just before COVID, and it was an eye-opener for me in more ways than one. I met my master, my mentor, Professor Jan Tuner from Sweden. I had read so much about him. I had read so many of his articles, but then coming face to face and then, sharing the podium with your biggest star, it was like nothing short of a fanboy moment for me. I never imagined that I'll be sharing a podium with Jan Tuner in this birth for sure. So that was the man who made me realize that laser dentistry is not tomato cutting the way it is taught in our country. That is when I realized that laser is not a substitute for the drill or the scalpel. Unfortunately, 99% of the so-called laser dentists know only about the cutting aspect of it. They have no freaking clue what this magical science can do beyond cutting. So that was an eye-opener for me, spending those days with Jan Tuner and understanding, how we can use this pure form of energy for various other things other than cutting. I happened to be with Michael Hamblin, the guy who has authored the first textbook on using lasers for neurosciences, for traumatic brain injury, for Alzheimer's. So this was something, something which was not less than a miracle, because here I am sitting with the best in the field, talking about things which I never thought were possible with lasers. So it was an eye-opener for me in more ways than one. And here I am trying to do my best to create that awareness, to spread that awareness, and to make people realize that don't look at laser as a substitute for the drill or the scalpel. It can do much more than that.
Actually, sir, after listening to you, my perspective of seeing laser has also been changed. All these days, all the normal dental graduate, what they think is laser is just a replacement for an bloodless surgery, or it is just a replacement for a scalpel. You said it very right.
We can't blame them, because this is what has been taught to them. This is what I knew for 10 years after I started practicing lasers. Since 2006, for 10 years, that was for a decade, I was an expert cutter. And for a decade, I kept fooling myself that I'm getting amazing results with these procedures because of my superior surgical skills. I was not aware that even beyond my understanding, there is something else that is happening, which is actually giving us better healing, and it is not necessarily my surgical skill. So when the teachers who train these students do not know about this science, how do we expect the students to know the truth behind it? That's the sad part of the story.
I hope someday I too get a chance to attend your lectures, because these things have been fascinating me a lot, these new technologies. Anyways, your contribution extend beyond clinical practice to an educator and innovator. Could you share some light on your role as a researcher, educator, and innovator, and how these roles intersect to drive progress in the field of dentistry, sir?
So it's nothing more than connecting the dots for me. So if you ask me, it all started with my love for children. That's how I chose to be a pediatric dentist. When I understood that my care for the children that I serve is incomplete unless I incorporate the recent advances like lasers, I started venturing more into this amazing science. I've been a university teacher. In fact, I've headed the Department of Pediatric Dentistry with 9 postgraduate students for almost 7 years, and I've recently been promoted as director of the institute. Now I head the country's only Department of Laser Dentistry and Biophotonics at Maratha Mandal Dental College, Belgaum, Karnataka. I was professor and head of pediatric dentistry in the same college. And again, this journey has been very, very fulfilling. Some of my students, my postgraduates, are doing amazingly well, and I feel so proud seeing their work. Yes, at the same time, I had this itch to make laser dentistry affordable to Indian dentists. I was very, very inspired by Ratan Tata. He was the first guy who made us realize that we Indians could afford a car. Nobody had thought that a car, I'm talking about the Nano, could be made under ₹1,00,000 or for ₹1,00,000. So he was the first guy who made us understand that you could design a car for ₹1,00,000 and then every Indian family could afford a car. I was so very inspired by this story that I always kept telling myself that one day I'll design a laser which will be made in India for less than ₹1,00,000. And it came true in 2019 when we launched our first laser under the banner of Novolace. It was an 810 nanometer laser. It is still available, and it was launched at ₹99,000. And the cost of that laser is ₹99,000 even today. So that's how we are making our bit to contribute to this amazing science. We want people to realize that laser dentistry is not about cutting. You can do amazing things. And this particular equipment that I'm talking of can do photobiomodulation, can do photodynamic therapy, and it costs you less than ₹1,00,000. So it's been a very, very fulfilling journey, I must say.
Yes, sir. Your inspirations are also same as normal people. Giving your remarkable journey and expertise, what message would you like to convey to the aspiring young dentists across the globe who are looking to make a significant impact in the field of dentistry?
Well, COVID-19 has taught us a very hard lesson. And that lesson is that uncertainty is the new certainty. So the sooner we stop cribbing, the sooner we stop complaining about circumstances, the better it is for us. We cannot blame these young dentists who are coming out because the kind of negative picture that has been painted, the kind of negative projection that has been given to them all through their 5 years of graduation. I feel bad for them that they come out with such a negative mindset that they are on a ship which is sinking for sure. They feel they are on a Titanic which is eventually going to sink. And their own professors, their own teachers who have, had their share of whatever little success or failure, they try to paint the same picture to those youngsters, and the youngsters believe it, that this is what this profession can offer and nothing beyond that. They think doing root canals and placing implants and doing rehabs, full mouth rehabs, is the only thing that dentistry can do. And instead of finding their niche, instead of finding that exclusive touch to their practice, they want to do the same thing what their neighbors are doing, and they all end up cribbing that we don't have enough patients. They end up doing unethical things, which ultimately brings a bad name to the profession. So I just want to share one message to all the youngsters who are listening to this podcast. Trust me, with 18 years of my experience, this is the best time to be a dentist. You have the kind of technology that is there at your fingertips. You can choose to do what you wish to do and make a difference to the lives of so many patients whom you see on a daily basis. The only thing that you need to do is find your niche. I hope you know what I mean by finding your niche. I repeat what I just told you. Uncertainty is the only certainty. So stop complaining, stop cribbing, find your niche, upskill, evolve, and then you will be ready to conquer. Find your niche, upskill, evolve, and then you will be ready to conquer. Don't fall into that trap of believing what you see. Don't fall into that trap of what your seniors or what your teachers would have told you, that this is what dentistry can do and nothing more than this. Try and explore what technologies have made it possible today. As a dental surgeon, what is it that you can contribute to the oral health and the general health of a patient? You will be amazed to see. Just visit a nearby cancer hospital. Every patient who's having, treatment for cancer, whether it is chemo or radiation, invariably will be having mucositis in the mouth. This is just one example. One example. Cancer mucositis is such a big problem for which we don't seem to have an answer. Who is going to be responsible for treating these patients? The oncologist? The physician? Not at all. They have no freaking clue. They can't think beyond Kenacort, and they can't think beyond using antioxidants and mouthwashes. So there are so many fields like this which need the services of trained dental surgeons who are experts in that particular area or in that niche. So rather than cribbing about the same things what your neighbors are doing, try to find your niche, and then you will thank yourself for having chosen this amazing profession which can heal people, which can make a difference to so many lives who are suffering because of the pain and the discomforts associated with some other treatment that they are taking, which ends up ruining their oral health. This is just one example that I just told you. There are hundreds of such instances where we need trained dental graduates on the field to do the job.
Sir, your journey is truly an inspiring to aspiring dentist and healthcare profession worldwide. We thank you for sharing your insights and experience with us today. Your dedication to push the boundaries and your commitment to excellence are truly commendable. Thank you very much, sir.
It was my pleasure and an absolute privilege to be on your show, and I wish the entire team all the very best, and also all the listeners of this podcast. I wish you well. Take care.
Thank you, sir. Thank you very much.
Thank you.
I'm your host, Dr. Ganendra. As we wrap up this insightful conversation, I encourage all our listeners to connect with us on social media and keep an ear out for upcoming episodes of the Molarbear. Stay engaged, remain positive, and continue to share your wonderful smile with the world. Thank you for joining us today. Bye-bye and have a great day ahead.